So your doctor just prescribed metoprolol, and you're probably wondering, what is this stuff, really? Well, you've come to the right place. We're going to walk through exactly what this incredibly common heart medication is all about so you can feel totally confident and informed about your treatment. Getting a new prescription can feel a little overwhelming, right? There are so many questions. Our goal here is to cut through the confusion and give you clear, simple answers. Let's dive right in.
All right, first things first, let's talk about what this medication actually is. Think of it as a new helper for your heart.
Okay, so metoprolol belongs to a class of drugs called beta blockers. And you see that word cardioselective? That's just a fancy way of saying it's a specialist. It's designed to zero in on your heart, blocking the effects of adrenaline. Its whole purpose is to make your heart's job easier.
I love this analogy because it's perfect. Imagine your heart has a gas pedal, and hormones like adrenaline are constantly pushing it down, telling it to go faster and harder. Metoprolol is like a gentle, steady foot, easing up on that pedal. This lets your heart beat slower and with less force, which is a huge help for a few key conditions.
So that leads to the next big question. Why you? What exactly does metoprolol treat? Let's get into the main reasons a doctor would prescribe it.
The FDA has given the green light for metoprolol to treat three big ones: high blood pressure, which doctors call hypertension, chest pain, also known as angina, and it's also used to improve survival right after a heart attack. Plus, a specific type of it is a cornerstone for treating chronic heart failure.
And this is what it all means for you. Easing off that gas pedal has some amazing benefits. If you have high blood pressure, it lowers your risk of stroke. For angina or chest pain, it means you can be more active without that discomfort. And for heart failure, wow, the results are powerful. It's proven to help people live longer and stay out of the hospital.
Okay, moving on to something that is super important and, frankly, a little confusing for a lot of people: the two main types of metoprolol. Let's clear up the whole tartrate versus succinate thing right now.
The easiest way to think about it is like the story of the tortoise and the hare. Metoprolol tartrate is the hare. It's immediate release, meaning it gets to work fast, but it also wears off faster. Metoprolol succinate, that's the tortoise, extended release, giving you a slow, steady dose that lasts all day long. This chart breaks it all down. You'll see the different brand names, like Lopressor for the fast-acting one and Metoprolol XL for the long-acting one. But the biggest difference for you, day-to-day, is the dosing. Tartrate is usually taken a few times a day, while succinate is a simple once-a-day pill. This is also why they're used for slightly different things. The fast one is great right after a heart attack, and the long-acting one is a lifesaver for chronic heart failure.
Now, don't be surprised if your doctor starts you on what seems like a really tiny dose. That's not just normal, it's actually the best way to do it. It's a strategy called start low, go slow. It gives your body time to get used to the medication, which cuts down on side effects and makes sure it's working safely for you.
Okay, let's switch gears and talk about safety. It's really important to know the difference between common side effects, what you might expect, and the serious warnings you absolutely need to watch for.
So these are some of the most common things people feel. Feeling tired or a bit dizzy is super frequent right at the beginning. I mean, think about it. Your body is adjusting to a brand new, lower blood pressure and a calmer heart rate. The good news is, for a lot of people, these feelings get much better over the first few weeks.
All right, I really need you to lean in and listen to this next part. If you only remember one single safety rule from this entire explainer, please make it this one.
This is what's called a boxed warning. It's the most serious alert the FDA puts on a medication, and it's there for a very, very good reason. Your body gets used to the drug helping out, and if you stop it suddenly, you can get a huge, dangerous rebound effect.
And this quote from the FDA tells you why. It's like taking your foot off that brake pedal we talked about and slamming on the gas instead. Suddenly stopping can lead to severe chest pain, a heart attack, or even life-threatening heart rhythms. So if you ever need to stop taking it, your doctor will create a plan to slowly lower the dose over a week or two. It has to be done gradually.
Besides that major warning, there are a few other important things to keep in mind. Because it can affect your airways, you need to be careful if you have asthma or COPD. If you're diabetic, it can hide some of the key warning signs of low blood sugar, like a racing heart. And for some people, it can worsen circulation problems like Raynaud's disease.
We're on the home stretch now. Let's finish up by talking about how you can stay safe, focusing on drug interactions and some final key takeaways for you. This might sound a little technical, but the idea is actually pretty simple. Your liver has an enzyme that acts like a cleanup crew for metoprolol in your body. But, and this is a big but, Other medications can basically block that cleanup crew from doing its job. When that happens, metoprolol levels can build up and get dangerously high.
And this is exactly why it is absolutely critical to tell your doctor and pharmacist about everything you take. As you can see here, some common antidepressants can make metoprolol levels skyrocket. Other heart meds can add to its effect, slowing your heart rate down way too much. And yep, even common over-the-counter stuff like ibuprofen can make metoprolol less effective.
So here is your action plan, a simple checklist to keep you safe. Number 1, be consistent. Take it at the same time every day with some food. Number 2, know your numbers. Check your heart rate and blood pressure like your doctor says. Number 3, and I'll say it one last time, never stop taking it suddenly. And number 4, be your own advocate. Tell every single person on your healthcare team that you take metoprolol.
Metoprolol is an incredible medication, a powerful tool that has literally saved countless lives. And by understanding how it works and how to use it safely, you're not just a patient anymore. You're an active, informed, and expert partner in your own health.